So when considering a top-line view of the cancer statistics South Africans are facing at the moment, one can consider statistics separately for males and for females. So based on our most recent statistics, men have a 1 in 7 or 14% lifetime risk of cancer. Women have a slightly lower lifetime cancer risk of 1 in 8 or 12%. So what are the most common cancers affecting males and females? The prostate cancer is the most commonly diagnosed cancer in men, followed by colorectal and lung cancer. Breast cancer is the most commonly diagnosed cancer in females, followed by cervical cancer. Frequency of screening tests is guided by many factors, and these include the individual's age and also what is the risk for developing cancer. So screening tests are usually not required in very young individuals because the risk is simply not high enough to indicate screening. However, if someone has a family history of cancer, or there is a genetic condition present which may predispose an individual to developing cancer, screening may be required more frequently, and it also may be started earlier. It's very important to be practical and also to think about cancer prevention holistically. So diet and exercise form one part of cancer prevention. However, I like to think of cancer prevention in terms of a 5-step approach, or the ABCs of cancer prevention. So A would stand for having an awareness of risk. So this would involve finding out about one's family history or any other risk factors which may be present that could increase the risk of developing cancer, and taking note of these. And then we, from this, move towards B, which is to be proactive. So take steps to find out what is the most current information available and what is the best practice around preventing cancer. C is for check. So identify what screening tests are appropriate for your age and your gender, as well as your health profile, and make an appointment with your family doctor to have the necessary health checks when required. It's also important to remember to go for general health checks, such as checking your blood pressure, your glucose measurements, and your cholesterol as well regularly. D is for don't forget to plan ahead. So reflecting back on South Africa's cancer statistics, so 1 in 8 likelihood in men and a 1 in 7 likelihood in females, it's very important to have some planning in place should something such as an early cancer diagnosis occur. Lastly, E, and simply it's that every action counts. It's impossible to do everything perfectly. Sometimes life gets busy and one may not have enough time to go to the doctor for a health check, or one may not have enough time to exercise 5 times a week, or you simply might end up eating a bit more because of stress. However, what's important is to be consistent, stick to healthy habits as much as possible, and very importantly, take time to go for regular health checks. Firstly, cancer prevention starts at any age. Taking steps to follow a healthy lifestyle when younger decreases the risk of developing chronic diseases and cancer as one gets older. So one doesn't have to wait until one reaches the age of 50 to go for screening tests. Cancer prevention can actually start much, much younger. Secondly, it's very important to be aware that steps to decrease the risk of cancer are possible. So if you have a medical aid, check what screening benefits are available on your medical aid plan and use these. Also, talk to your family doctor and develop an holistic cancer prevention plan. Consider lifestyle steps that could decrease your risk of developing cancer and apply these. Lastly, every action counts. Every step taken to improve one's health matters. So it's very important to focus on living a healthy lifestyle.